wheel it around.
I'm gonna engrave my name on it. It will be big and tall and audacious. And I don't care.
You can get a ball like mine, you just roll your ball around.
No.
Papers.
I like it.
No, I mean, that's part of the conversation.
I'll put a disclaimer, taxpayer money was not used in the purchase of my King Midas chair.
We need to change the job description.
That's funny.
Kind of loosen up, because previously you were going for the high end, you were looking for the middle ground, so we need to change that job description, bring down the qualifications, and change the pay rate.
Well, in other non-county news,
Somebody with some
5 to
experience.
10 days tops. 5 to 8
Is
days
that what I
tops.
feel like, so I think that that's part of that.
4 to 7 days.
To have you change that description, that's just the last one we had, so we started.
Very excited about this. Dear. There's some props. Oh yeah. Oh yeah.
She's on the way. She had someone in
I
the
figure if
office.
enough time elapses, I'll be like, oh yeah, I bought that a long time ago. Like she does with clothes, like a new outfit. Is this new?
No,
No, I got this last year. I don't know, a long time ago.
Define new.
Exactly.
That's right.
After enough passage of time, it's not new, and
No.
it's not like you're gonna get in trouble for it. Wow. I think.
Got the same issue in my house.
I don't know.
Got it.
I thought you were in another chair spot.
Robots.
In other positive news, it's about as perfect as it gets out there.
That's what we were just talking
This
about.
is my favorite season. I don't like it when it's rainy and 48, but
It could stay like this for
oh yeah,
the next 3 weeks.
I love it. We need people to start burning leaves soon, so the air smells a little better.
Friday's gonna be brutal at the football game.
What is it, rain?
Possibility of rain, but the high for the whole day is only like 49, but low of 33.
And it could be brutal. It could be brutal for another reason.
Well,
Who are you playing?
Johnston.
Yeah.
Yeah, it's, I don't know that they're as good as they have been, but
Got
probably
your equipment?
all we can handle.
Thanks so much.
And maybe a little more.
So, there's a food drive, and it's band night. And it's
Mark was so maybe that I'm going to take an umbrella and hold it over.
What's that?
Mark thinks I'm going to take an umbrella and hold it over.
Oh, we'll see how that goes.
Megan, I will send some cans of food with you.
With me, yeah.
And
I'm
Take-
good for a few cans of it too.
take pictures.
All right, we're calling the meeting to order. Our first item on the agenda is 2020 health insurance renewal review. First, could we have roll call?
Scholl.
Here.
DeCook.
Present.
McIntyre.
Here.
All right, thank you. I'll take one down and pass it around. I think I got plenty. Just perfect. Thank you for allowing us to come in. As you know, this is kind of that annual root canal known as the health insurance renewal. Started the process this year really early. Met a number of times with Aaron and Heather and Dawn, kind of talking through what's going on and what it looks like. For the purposes of discussion today, I've kind of pared down what we've talked about, seeing that it's a public meeting. So I want to give you a high-level overview of claims, what's driving cost for the group, without getting into any sort of personal details or anything like that. But ultimately, kind of high level, what it looks like, review the initial renewal, and then provide a recommendation for the plan for 2020, and then answer any questions that you guys have, okay? So stop me at any time. If you turn in, page 3 is claims experience at a high level, looking at incurred claims versus paid premium. So naturally, the insurance carrier looks at a loss ratio. What have we paid in versus what have they paid out? As a quick snapshot, you'll see anything in red is over 100%, meaning they paid out more than we paid in for that month. As a general rule of thumb for an insurance carrier, for them to break even on a group, we like to see that somewhere between 80 and 85% each month, when you take into consideration their administration, overhead, everything else. So 85 cents on every dollar goes to pay for claims, and then 15% for overhead. So kind of a general rule of thumb, anything less than that, they're making money. Anything over that, they're essentially losing money. So for the year to date, this was claims through August of 19. You can see we're running about 82%, okay? Kind of a bad year in 2017, a little bit better year in 2018, and then, kind of running on trend here for 2019. What's driving claims? What I like to look at is per member per month. So you'll see there paid claims and then claims PM. That's per member per month. That allows us to look at the data on an apples to apples comparison, right? Your head counts are going to fluctuate month to month based on, people that are working and people that retire and new people that come on, and so looking at it as a per member per month. You'll notice year to date 2019, every category is up except inpatient claims. Okay, so our office visit claims are up from $82 to $90 per member per month. That's not a bad thing, right? I mean, that's the cheapest cost of care is going to an office visit. So, driving people either through to an office visit or to telemedicine is certainly better than an urgent care, an ER, or a specialist, right? So we want them to have claims in an office. That number of $90, I would say is probably 10 to 15% better than our book of business in the metro in terms of average cost per office visit. We normally see that probably north of $100 and even probably north of $110. So I think that's performing really well. Inpatient claims is down a little bit. Outpatient claims is up, and then pharmacy claims from 108 to 137. That's a pretty significant jump. And that's really largely driven by specialty medications. You see it on the news. So if you think of all the commercials you see at night during the 5 and 6 o'clock news, whether it's Humira or any of those others, those are by and large specialty medications. And just to give you an example, an average cost for a specialty medication under the Warren County plan is about $4,500. And typically those are on a monthly basis, okay? We got introduced to specialty drugs with things like rheumatoid arthritis, MS, by and large a lot of pretty life-saving drugs, right? It's the difference between me probably staying home and not being able to work with RA and then being able to come to work and have a quality of life. That's what they're intended for. What we've seen and will continue to monitor for all of our groups is we've seen those drugs start to get prescribed for other things that not necessarily have to go straight to a specialty drug. There may be a combination of preferred brand names or other things. And so continuing to look at that, pharmacy trend right now is about 16%. Overall medical trend, essentially what is a procedure that I have 12 months from now going to cost versus if I had it today. Wellmark is using about 7.5% trend. Okay, the vast majority of that, or a lot of that, is driven by prescription drugs and most specifically specialty medications. Okay, so we have a little bit of that going on. I think in our meetings, probably more frequency of specialty meds than what we would see with a group of your size. And so we'll continue to kind of look at some of that, okay? If you look at that graph, it's a good way to kind of take a peek. The yellow down at the bottom, paid claims, 40% of our claims are coming from pharmacy, 26% office, 10% inpatient, 24% outpatient, okay? The only thing there that stands out is that pharmacy claim, 40% of our overall spend is coming from prescription drugs. That's high. That would benchmark high. We'd like to see that try to trend back down to 25 to 30%. Not necessarily, have to do that, or maybe it's not possible, but to see 40% is high. The challenge that the county has, like any public entity, is turnover is good for a health plan, right? Most public entities don't have a lot of turnover. You have great benefits and people have good jobs and they stay for a long time, which is just the nature of public entities. And so a lot of times in the private sector, we'd see some of this specialty drug utilization come in and then go off. Maybe they're not at work, maybe they find other employment, maybe they go on their spouse's plan, whatever it may be. Whereas in the public sector, not just you guys, but every county, city, school, once you start to have some of that, it tends to be a little bit sticky, and you have to figure out a way to manage that cost long term. Just because by the nature of what you do in your employment, you don't have a lot of turnover. Okay, so it's stuff that we'll look at and things that we will continue to monitor. But kind of gives you a snapshot of location of service. The last thing I'll touch on with claims is just our chronic conditions. I like this report for you guys as elected officials to know kind of what's driving those claims. So there's two different columns. There's a paid amount and then there's a frequency. Okay, so claimants. So our top category by frequency, or with claimants, is osteoarthritis. Knees, joints, bones, hips. That's just the nature, again, of everybody getting a little bit older. Second behind that is obesity, right? A lot of people will tie osteoarthritis to obesity. Maybe I'm carrying too much weight or what have you. Hypertension, and then the next two, mental health, depression and anxiety. A lot of times people look at that and it's surprising. I can tell you we've seen that across the board. From a frequency standpoint, be in that top 5 or 6 for a lot of our groups, okay? And then by paid amount, you can kind of see there on the left-hand side kind of where we're spending our dollars in terms of chronic conditions, okay? Any questions on kind of any of that as we talk through that? I don't want to, I'm happy to provide further documentation, but just want to make sure you kind of have a high level of what's driving cost. The next 2 pages, I just want you to go into kind of give you an example of how we underwrite. So part of our role as your consultant is to make sure the numbers we think match up that the insurance carrier gives us, whether that's Wellmark or any other carrier. This is Lisa's claim to fame as an underwriter. We look at that on a rolling 12 months. So you'll see on page 6 goes back to January of 2017. On the left-hand side is your head count. On the middle column is paid claims. Okay, so you'll see there's some shaded boxes. There's an offset there of 2 months. So you'll see, for example, June of 19, it stops being shaded on head count, but it's it is shaded up through August 19th. The reason for that is we know if I have a claim and go to the doctor in June, that claim's not going to get paid really until probably July or August. So to make sure that we're accounting for the true population. If you look at the right-hand side, you'll see paid claims, 1.9 million for the prior 12 months, just about 1.9 million for the most current 12 months. The number in red is we reduce the number of claims over 75,000. So if I'm in the hospital for a month and I rack up a $500,000 claim, the first $75,000 of that claim, the county essentially gets credit for. Anything over $75,000, Wellmark provides reinsurance, so they don't necessarily hit our experience as an entity. We get charged for it, and I'll show you where on the next page for what they call a pooling charge. But so you deduct those claims over 75 divided by the membership, and you can get that per employee per month claim cost. So $11.52 for the prior 12 months, currently $9.49. Okay, so trending in the right direction, large part driven by the reduction in inpatient claims. That's really where where a lot of spend is going. So overall, not a bad looking renewal as we look at it, okay? The next page is we look at that independently. We say if we were to look at your claims and your population, independent of any insurance company, and say, should we go self-funded? Should we pay our own claims? What does that look like? We kind of come up with some math. Okay, in years past, sometimes this is better than what the insurance company gives us. Other times, our projection is worse. Okay, You look at that, you see current year and prior year. So we weight 80% to the claims that we have during the current period. We weight 20% to the claims we had a year ago. We have to trend all of that forward. Okay, so you'll see the prior trend, we've used 8%, so maybe a little bit conservative. But we take our current year claims, what we've had through August, and we have to get those to the end of this calendar year. The prior year, we've got to bring all of our claims from a year ago up. So apply a lot of trend to get those to the end of this year. That gives us our weighted claim cost of $1,034 per employee per month. Okay. We then have to take that and say we got to forecast and trend it all the way through next year, the end of calendar year 2020. So apply that 8%, gives us our claim cost for projection of 1117. Take it times the number of employees times 12. If we stopped today and looked at it, we would think that you would have just over $2 million in paid claims for 2020. Okay. We build in fixed costs, so True North compensation. The pooling charge, okay, that $153,000, if you remember the red numbers we deducted out, that's ultimately what we're paying in for that. Essentially, think about it as reinsurance, claims over 75, and then a 15% estimate for administrative expense. That gets us to all expected $2.56 million, $576 million, compared to our current annual premium. If we were looking at you today as a self-funded entity, we would say you probably would need to increase your rates 13%. Okay? All right. The good news is our renewal is significantly less than that, number one, and number two, we've got options to even reduce it beyond that. Okay? But just wanted to give you kind of some thoughts on independently kind of what we're seeing. All right, any questions on how we get to that number? I know this is small, there's a lot of numbers, but wanted to also kind of paint you a picture. So if we did nothing different and we renewed on the exact same plan designs, we did nothing different with contributions for employees, the bottom right-hand column you'll see that percent increase is 7.02%. So Wellmark's increase came back initially at 7%. Currently, what that would mean for the county is in your medical plan, the county's paying $1.961 million. If you did nothing different, the county would absorb basically $2.099 million, or an increase of $154,000 if we did nothing different to the plan designs or contributions. Does that make sense? Okay, from an apples to apples. So assuming no changes to any of that, that's kind of where our renewal is. If you turn to the next page, current benefits as a reminder. Wanted to just remind you of what the current plan looks like, okay, before we talk about alternates. Remember, you have three plans, okay? You have a $750 deductible, a $1,000 deductible, and a $1,500 deductible, okay? The $750 plan is on the Alliance Select network with Wellmark. That is the biggest, baddest, broadest network, okay? Inside the state of Iowa, 100% of the hospitals and 99% of the physicians are in network. If I'm on that $750 plan, I can go see anybody I want to go see in the United States as long as they're a Blue Cross Blue Shield provider of that state. If I voluntarily want to go to Mayo Clinic, or I want to go to MD Anderson or Cleveland Clinic, or I'm traveling in Colorado for spring break and I get sick and I need to see a provider, as long as you see a Blue Cross provider nationally, you're in network under the Alliance Select plan. Okay? You'll see the $1,000 and $1,500 plan are Blue Access. Okay, that would be considered Wellmark's HMO plan. Okay, essentially what that means is that inside the state of Iowa, it's really exactly the same. So 100% of the providers or hospitals are in network, and about 97% of the physicians are in network. What you lose from a physician standpoint in Blue Access is a handful of chiropractors. And then in far northeast Iowa, there's a little bit of hole where there's a regional health system called Gunderson, where the Wellmark HMO doesn't cooperate with. Okay, but most of your care locally, it's going to be challenging under any of these plans to find a doctor or physician that is not in network. Okay, from there, that's the primary difference. From there, you'll see the differences in the deductibles, the out-of-pocket maximums or OPMs. Okay. So essentially, as you work your way up, you get a little higher out-of-pocket maximum. Okay. Each one of those plans has copays, right? $25 office visit copay, $50 for a specialist, $10 doctor on demand. Encourage people to use your telemedicine, and then your prescription drug copays there at the bottom. All right. So, kind of lay of the land of what it is there. Any questions on that? All right, so what we've talked about, and I think what we would recommend is continue to get the plan in a place where it's financially stable for the long term. If you remember back when we started working together 5-6 years ago, we had a $250 deductible and we were worried about Cadillac tax, and you had one big composite rate, and so we've every year taken an incremental step to get it to a place where A, it continues to be really affordable for the employees, B, they have really great options, but C, protect the county from a financial perspective as we go forward, okay? So here's what we would talk about, and then I'm open for any sort of questions or other recommendations, but just for simplicity, we kind of honed in on one alternate. What we would do is eliminate the $750 plan, okay? So that basic plan there. We would add a $2,800, what we call a high deductible health plan. So HDHP with a health savings account. I'll talk about that in a second. We'd make the $1,000 and the $1,500 plans an HMO, so that blue access, which is what they are essentially today, right? So no change to that. And we'd have the high deductible health plan, PPO, on the Alliance Select network. Okay, so for some people it's important just from a comfort level that I can go see anybody at any point in time. So still have that option available. It just becomes on the high deductible plan, not on the $750 plan. We consider incentivizing employees to move into that high deductible health plan, okay, by contributing to a health savings account. You can do it in a variety of different ways. You could put a lump sum in, you could put a monthly contribution or quarterly contribution. Some people do it like a traditional 401k match where an employee has to put money in first and then the county would contribute. We can talk about that. Okay, and I'll run through this here in just a little bit. And then the second thing that we would do is increase employee contribution percentages by 2% on the $1,000 and the $1,500 plan, but not have any increase on essentially that plan 3. So not raise the percentage contribution on the high deductible health plan. Okay, and I'll kind of lay it out and maybe make a little bit more sense. Some key things to keep in mind. Naturally, we want to make changes that are going to impact as few amount of people as possible and have the biggest bang for our buck. So 93 of our 149 enrolled employees are either on the $1,000 or $1,500 plan already. Okay, so effectively no change. If they were to say, I want to stay in exactly the same plan, they could do that. The only change would be a 2% increase essentially in their monthly contribution, but the plan design wouldn't change. Employees are still eligible for their wellness credits. So if you remember, part of our wellness plan is if you accumulate points, you're eligible for a $50 a month wellness credit. So the premiums that are on here are non-wellness. So if I qualify for wellness, I can take $50 a month off of that. Even if you were to make this change, you're still offering and maintaining richer than average deductibles, out-of-pocket maximums, and certainly monthly, premium contributions. Even if you benchmark that against the public sector, we've seen people really get away from the $500, $600, $750 deductibles. We've also seen a lot of public entities introduce high deductible health plans to the marketplace. And then ultimately, I think this gets you in a position that the health plan becomes more financially stable as we go forward. Hopefully controlling increases, and then lastly, still providing employees, I think, really great options to be able to provide for their families as it relates to health care. Okay. All right, if you turn the page, 2020 proposed benefits. Okay, if you remember the last time, it was $750, $1,000, $1,500. Okay, I talked about the differences between the plans being deductibles and network, and I talked about they all had the same copays. All right, you'll notice the $1,000 plan and the $1,500 plan are exactly the same as what you have today. The difference is that $2,800 high deductible health plan. The thing that you'll see as you look at that is it eliminates your office visit copays. Okay, so this is what you hear on the news is consumer-driven health, healthcare or health savings accounts, and you look at that and you say, okay, I've got a $2,800 single deductible, not to exceed $5,600 for a family. But you'll also see that the out-of-pocket maximum is exactly the same. Okay, $2,800 per person, not to exceed $5,600 for a family. That's different than the other two plans. Take the $1,500 plan as an example. If I'm a single employee and I'm enrolled in single health care, I'm on that $1,500 plan, I'm in the hospital, I rack up that big $50,000 claim, okay, I pay the first $1,500, right? And then I go into my co-insurance, which is 20%, so then I start paying 20% of the remainder of that claim up until my out-of-pocket maximum is $4,500. Okay, once I hit $4,500, everything is paid at 100% for me, for the remainder of the year. On the $2,800 high deductible health plan, in the same scenario, I'd pay $2,800, but because that is the same as my out-of-pocket maximum, the most I'm going to pay is $2,800. So this becomes the lowest, essentially, out-of-pocket maximum for the employees. So if I know I've got something coming up, or I'm prone to breaking bones and all that other stuff, from a financial liability standpoint, that becomes essentially the best option. Does that make sense how that kind of works? What do you lose? You lose your copays. Okay, and a lot of people, our healthcare system's been built on the comfort level of when I go to the doctor today, I pay him $25. When he sends me down to Hy-Vee to pick up my prescription, if it's a generic drug, I pay $15. If it's a brand name drug, I pay $30. Right? It's kind of how we've grown up. Under the high deductible health plan, I get to pay the full retail cost of that after it goes through the discounts. So Wellmark applies the discounts, and then I get to pay the rest. My family is on a high deductible health plan, my wife and 3 boys. We're on a $5,000 single deductible and a $10,000 family maximum. When we take one of the kids to the doctor in Altoona or Ankeny, we pay $120. That's just what the cost of a general office visit is. People say, why in the world would I do that, right? It feels different, and it takes a little bit of education, all right? The doctor sends us down to get a prescription. We go to Hy-Vee, and it's a generic drug. There's times where that costs 87 cents for amoxicillin. There's other times when maybe it's a brand name drug, and it costs $200, right? You get to pay the full cost. Everything accumulates up to that out-of-pocket maximum. So if I hit that, then everything's covered at 100%. Office visits, prescription drugs, okay? Preventive care is treated the same way under all 3 plans. So your annual preventative visits, your age-appropriate exams, mammograms, all that good stuff is covered at 100%. So it shouldn't cost you anything under all 3 plans. Okay, so why would I do that on the $2,800 plan? If you turn the page, without getting into too many numbers, the reason people do it is the ability to pair up a health savings account with your high deductible health plan. Okay, so with my high deductible health plan, I have a health savings account, which is essentially a checking account that you can use for medical, dental, and vision expenses for you and your dependents. Okay, you put money in, it goes in tax-free. If you invest it inside of that institution, it grows tax-free. And as long as I use that for eligible medical, dental, and vision expenses for my lifetime, I never pay tax on it. Okay? The IRS caps what I can put in. I believe the single level is $3,600. Families just over $6,000 for 2019. It'll change for 2020. Okay, so that's the most you can put in. Okay? So it's a great vehicle. You put that money in, I can choose to use it when I want to. Or I can save it. If I don't spend it, it's mine. It is a personal checking account. It stays with me. If I retire or if I leave employment at Warren County and I go somewhere else, I get to keep that money. Okay. If I decide, I'm going to go into that plan this year, and then next year or the year after, I say I want to go back to a traditional plan, that has co-pays and all that other stuff. You can do that, and as long as you have money in that account, I can always use that money to pay for my co-pays, to pay for my prescription drugs. I just can't put money in that account unless I'm in a qualified high deductible health plan, which for you would be that plan 3. Okay. Think about it a couple different ways. So my family this year, I was in the hospital in January, we had a baby in February. I've been diligent since the beginning, now 8 or 9 years, of putting money away every paycheck. I just set it up like my 401k, it goes in. I had a $10,000 expense and I paid for it with my health savings account. It's worked for our family, but I'm traditionally a saver. My parents, on the other hand, my dad's 66, my mom's 64. They've had a health savings account since the beginning. We were just talking over the 4th of July about they've looked at theirs as purely a retirement account. And so they started funding it right away. Their employer puts a little bit of money in. But my parents have never used it. Knock on wood, they've been healthy. When they've had to go to the doctor for a sinus infection, they've just paid out of their pocket and not touched their HSA money. My mom didn't know this, so I feel like I helped her out, but maybe she'll take me on a trip. But over the last 10 years when she's been on the health savings account, they've never used the HSA money, but she's kept every one of her receipts. So she looked at me, her question was, Kyle, we've accumulated a sum of money. I don't know that we can spend it, on Medicare, over the next 25 years. What do I do with it? Can I stop funding it? Can I take it out? Can I, how does that work if something happens to your dad and I? And I said, did you keep all your receipts? Yeah, I've got all of them. I said, well, if you haven't used your HSA money, you can turn around and write a check out of your health savings account and reimburse yourself for those expenses at any time. So it offers a lot of flexibility, okay? So why would we do this? So if you go back and you look, the columns on the left are your renewal rates, okay? So you can see on the left-hand side, $750, $1,000, $1,500. So those are your current benefits. Those are the current renewal rates. So that would apply the 7% increase. Okay. The employee contribution percentages are what's there today, and then your total cost. On the right-hand side, you'll see making the plan design adjustments. So $1,000, $1,500, and $2,800. You'll notice on the $1,000 plan and the $1,500 plan, we've increased the employee contribution by 2%, which is what's allowable to you under your contracts. So for 12% to 14% from 17 to 19, okay? You'll notice that on the third plan, those percentages stay the same, 2%, 7%. Does that make sense? So don't make adjustments to that third plan. The box on the right, current county cost $1.96 million, renewal county cost $2.099. Under this proposed plan design changes, it takes it to $1.917. So essentially $181,000 decrease from your renewal, or about $40,000 less than what you're paying today for your health care. Okay? I've put in there the county spends about $58,000, $60,000 in wellness credits. Okay?
Can you say that again?
The bottom there, so in your wellness credits,
58.
you spend about $58,000. So if you look at the employee contribution, so let's say, for example, the PPO 2,800, you'll see 1,155. For those people that enroll in single coverage, their cost would, and get the wellness credit, their cost would be zero, right? You deduct that 50. So these are non-wellness rates for those employees that qualify for wellness, which how many do we have? Do you know off the top of your head? It's significant.
It's about 90 some.
Yeah, about 90 some. You take $50 off of those costs, right? So the question then becomes, what do you take the savings, or what do you do with the savings? And we would propose that you incent people into that high deductible health plan with some mechanism of a contribution into that HSA account. Some employers do a lump sum. So to say, this first year we're going to help you and we're going to put in a lump sum. Let's say it's $500 for a single or $1,000 for a family or whatever it may be. Some people say we're going to do a monthly, right? So for monthly single we put in $75, and for family we put in, $150 or whatever it may be, to get people in there, because people's fears are, something happens to me January 3rd and I slip and fall on the ice, I don't have a deductible expense. Keep in mind, the way this is set up is that becomes financially the best thing for my family, right? Because it's the lowest out-of-pocket cost. So in a catastrophic event, that's what happens. The idea would be if people move into that deductible range, and they put some money in and you help them save some money in that HSA, that over time you increase that deductible and out-of-pocket maximum accordingly. As people get accumulated balances and all that. Keep in mind and remember, about 40% of your population doesn't use the doctor once per year. Not even for a wellness visit. Okay? So keep that in mind. The second thing I want to draw your attention to is just the difference in premiums. All right, so let's look at, for example, just as a single. If I'm on a single today and I'm on that $750 plan, the top left column, I'm paying $83.82 a month. Okay, if we renewed with that plan, $83.82. If I change to that $2,800 plan, I'm spending $11, right? Round numbers, that's $70 a month. That's $850 a year. Okay, just in premium savings without going to the doctor, without using anything. So I could do a couple things. I could put that money in my pocket. I can choose to put that $850 in my health savings account. That goes in pre-tax. But the way I think about it is that becomes basically 8 office visits for me and my family, just in the premium savings alone. Right? Does that make sense? Are you kind of following how that works? So that's how we help try to explain some of that to employees, is say, listen, think about what your normal healthcare year looks like. For most of us, it's, you know, a couple trips to the doctor because we got the flu, and maybe a kid sprains his ankle playing basketball. Not all of us have surgery every day or have planned things coming up that naturally unexpected things happen. But think about a normal year and then kind of do the math and run the equation in your head to say what's the best, okay? So worst case scenario, I can stay on that $1,000 plan. If we put on, you know, in that $1,000 plan, I can get my wellness credit, and it still only costs me $35 a month, you know, for my health care as a single employee on a $1,000 health care plan, okay? If I'm an employee and I choose the $2,800, I still get that premium, or that plan essentially for no cost, because of the wellness credits if I get wellness. And then for the county, for you guys, taking that, you know, whether it's $181,000 or whether it's $50,000, that's different than what you're paying today. If and how you want to allocate that into somebody's health savings account to incent them to do that. Okay? I know it's a lot. Questions? Had a lot of conversation, I think, with the group that people were pretty comfortable, I think, with the idea and the concept.
That's the other thing that none of these plans, I mean, we're not forcing anyone to do anything. We're going to provide education, and ultimately, you know, the high deductible health plan, as I see it, really benefits 2 groups. Those that never go to the doctor, which is a lot of people, myself included. Unless I'm bleeding profusely, I'm not going. And those that go a lot. Those that have frequent surgeries. And then it's just a math equation of, is my max out of pocket more or less? And it is less. And so for those people, that infrequent users and frequent users, they're going to be better off if they do the math on it, but we're not forcing anyone to do anything.
Right.
I think I see some benefit there.
I would agree, and I think, you know, the challenge for the county, the way it's set up today, is that Alliance Select plan is your richest plan. It's the most costly plan, and so most costly for the county, but it's still extremely affordable for employees. And so how do we impact, you know, the insurance carrier looks at that and says, man, a $750 plan is a really rich benefit. I mean, we get charged for it. So how do we impact that component? And you can't do that by charging them more. You know, in the private sector, what would happen is everybody would base their contribution off the cheapest plan, you know, today the $1,500 plan, and they would make the $750 plan really expensive for employees. That's just the way they would do it. The county doesn't have that ability because of your contracts and how you can adjust premiums 2% a year. And so offering, you know, or they're on that plan because they want the lowest possible out-of-pocket cost, which still, you know, you can get that under that HSA. So tried to make it kind of a happy medium that would give people the Alliance Select network that they wanted it, as well as a lower cost out-of-pocket maximum. It's, you know, it takes a couple years for people to get used to it. It took my wife, I mean, I do this all day long, and my wife would still come home and be like, what kind of crappy insurance do you have that I pay $120 at the doctor, you know? I said, trust me, there's a method behind the madness. And I think as people get used to it, we've seen groups say, I can't believe we ever offered something without it. It just is kind of getting to that point.
Well, that's the point, is when you look at the premiums at 83 versus 11, that is 8 of those crappy experiences
That's the way I look
where
at
you're,
it.
where you're saying, well, why do I got a $120 doctor bill? Well, you've saved 108 or
And
800
your
and some
average
dollars
family-
over the course of
Most
the
of your
year.
people aren't gonna have 8 office visits, you know, I mean, if you play the numbers.
Sure.
And so I would encourage the county to look at that. I would encourage you to consider putting some money into the HSA. We've made some assumptions that 25% of your people would move into that high deductible health plan. That's kind of a best guess over what we've seen. Knowing that the $1,000 and the $1,500 plan are changing, and 95% of 95 people are on that plan contracts, you may get some people say, you know what, I'm just not even going to touch it. And so we kind of thought 25% would be a good mix. So, you know, the actual savings will vary depending upon, you know, how many people transition into that. But I do think it puts the plan in a position, in a healthier position than what it is today, and sets us up for success in the future.
So it really leads into the next question of an incentive to help get that 25% or
Yeah.
30%, or, I mean, frankly, with what you said earlier about who doesn't use the health plan for our county, which is a good percentage, those people would be wise to do it. And then those who use it a lot, those people are hitting their max out of pocket every year.
Right.
I mean, if you're on very expensive prescriptions and you're at the doctor frequently, make no mistake about it, you're paying the max MOP every year, and it's a lot of money. Those people would also benefit from it, although I would speculate there's going to be more reluctance for them to make the jump. So I think that incentivizing it, as much as I would like to see $40,000 or $50,000 of savings, depending on how many people make that transition, I think we would be well served to use some of that anticipated savings to incentivize it $250 and $500 or $300,
Right.
$600 or $500, $1,000, and so that's probably the next discussion point: is what are we going to offer to get people off the dime and into the plan?
Yep, I would agree.
Assuming that both my colleagues are okay with doing the general proposal of dropping one, adding this one, which I don't. Maybe that's where we start. Maybe I'm ahead of it a bit.
What are your thoughts on that?
I'm fine dropping the 750 and go to the 2,800 plan.
I'm also fine with it. That's why we met a few times earlier this summer. Crystal?
Yes, I think it's a great idea.
Yeah, good. Just running some math, and I don't know how aggressive you want to be. I mean, you can spend as much money as you want to spend into that HSA. You know, if you did, let's say 500 for a single, maybe that's low, maybe that's high. I don't know what you're thinking, but you know, if you did 500 for a single, if every one of your singles elected that plan, the outlay is $21,000. I mean, kind of your max liability under that. If you did 900 for employee spouse and employee children, it'd be $67,500. And if you did like $1,250 for family, it'd be, you know, $72,000. So just to give you a ballpark of, you're not going to have everybody go into those plans naturally. I don't know if that feels low, if it feels high. Those would be annual contributions, but we have groups that will fully fund it, you know, year one, and that's all they do, and say, hey, we're going to give you one shot, and if you come in this year, you're going to get your money. We've got others, most that probably do it on a monthly or a quarterly basis, you know, so we'll put an X amount in per quarter. But keep it in mind, you got a $2,800 single deductible, $5,600 family deductible. And if you think, you know, maybe 25% of people or 30%, we could kind of forecast something that would be a little bit higher to kind of say, if we looked at 30% of the people, this is, you know, this is what it would look like. But I just wanted to make sure you were on the page of this is the route we want to go.
Run by the 500, was that 21?
21,000.
And then 67?
And that's it if every single switches to the
Right,
plan,
right.
which isn't going to happen.
Right.
Next.
900 was 67?
So if you had, let's say, 67, and then 1250 was 72,000. But if you look at 10, let's look here. 12, 6, 12, 15. So essentially 25% is 37 people, give or take. You know, so if you break that down, 10 singles, 12 employee spouse and or employee children. So what I would do is probably structure it where you have a single and then you have an amount for employee spouse and employee children. So for those tiers it's the same, and then your full employee spouse, children, family. So maybe structure it that way. If you just did the numbers at 25%, it's 10 singles, 12 employee plus spouse or employee plus children, and 15 full families. So then you can back into, let's say you just want to spend the $50,000 in savings from your current plan today. You look at that, 537. It's an average of $1,351 is what, if you just took, say, well, we're going to spend 50 grand and based on 25%. Now that could go up, that could go down. If you wanted to say we want to spend $181,000 in all our savings to do it, then those numbers change drastically.
Yeah, but the 181 is from the projected 7%
Correct.
increase versus baseline last year.
Right. Which you're saving $44,000.
Understood.
Okay.
We could save more. You'd have to bump that out-of-pocket max, and those deductibles on that plan 3 up. And the thought maybe was get people introduced to the concept with some protection, allow people to save some money with the county's help, and then make people more comfortable with the concept, their saving mechanism, to be able to make sure we can afford it. So that would be, I think, really the only decision. What we would do is set up an administrator for you, so HSA Bank or somebody like Discovery Benefits, that what they do is HSA administration. So employees, it'd be easy for Megan and Heather and team to administer that. Employees could elect, I want to put $50 a paycheck away or whatever it may be. You can fund it with a normal check. If you wanted to put all of it in, January 1st, you can do that and then take the above the line deduction, personal deduction during your taxes. But having one bank or one administrator makes it easier for people to elect and easier for the group to administer.
If we backed it out and looked at using 30,000, ballpark the numbers at a 25, if you could, sorry.
Yep.
At a 25% singles,
Yep.
what does that look like? I'm guessing probably $750, $800.
30,000 minus, what's that? $810 per contract, which would probably get you. I can run some math and provide it to the group afterwards, so we can kind of maybe run some different scenarios. But I just didn't want to run putting in $2,000 and you come back and look at me like I got 3 heads or something. So I can, knowing what we'll do is we'll take kind of 25%, just benchmark that. I'll play off 30,000, 40,000, 50,000, kind of run 3 or 4 different scenarios, and I'll have that to you by the end of the day, just to give you some thoughts around what you would want to maybe kick in.
I think that'd be helpful.
Yes.
That's probably where I'm leaning is somewhere between 30 and 40, which is probably around
Still saving a
$800,
little money.
which is incentivizing the people to do it.
Yeah.
But it's also not, here's $1,500.
I wrote down 44, but 40 is the same.
Sure.
I mean,
Are you one-time contribution, or are you thinking an annual contribution, a continual? Because I think that would affect people changing over to the plan if they know
Yeah.
that the supervisors, or if it's a continual,
I'm up
or
for
if it's
one-time.
just a one-time shot.
My suggestion
If
would
it's a
be-
one-time shot, maybe you do a tad more the first year, which.
My suggestion is you would do it ongoing. And that's what we typically would see. So if say it's $500 for a single and I get that quarterly, right, I'm gonna get $125 in my account each quarter, for example. I would continue some sort of, because you're gonna have, you're gonna have new hires, you're gonna have people that maybe next year their lifestyle changes and kids come off and I wanna be able to come on. I think it's a good investment to have. And then I think it also gives the county the ability to feel comfortable that after a year or two or three and people have said, boy, I like it and I've got some money in my bank account, well, let's take that deductible up from $2,800 to $3,500 and feel supported in that nature. And so I think you're investing ahead. What you put into, and the other thing too for you guys, that becomes the employee's money. So I think it's a selling point for you guys that it's not wages, but if you elect it, we're going to put money in your account. That is their account to keep. That's not your money once it hits their bank account.
It's
That's their
tax-free money to keep.
Absolutely. So I think from a recruiting and a retention standpoint, it's a good. It's $50,000. I'm not going to tell you to spend your money, but I think it's something that I think is valuable as people understand it.
If you could write this down, one of the ones I'd like to see would be a scenario: 25% enrollment, 500 single, and 750 or 800 for
Mhm.
family.
Mm-hmm.
You mean that one?
Yeah, that's fine.
Yeah. Okay. Something like that.
I'll just we'll
And then maybe also 1,000 on family, but I there's something about the benefit I feel like should be most strongly tied to the employee and less of a connection as you're adding family and children to the plan. And
Yeah.
so I like to add something, but not on a dollar for dollar basis for the employee that's doing work for the county versus the child that is not
Okay.
doing work for the county. And so I like 500 and 750 or 500 and
Sure.
800 or whatever.
Yep. Yeah, you guys insure a lot. You are the plan of choice for most of your employees and their family, without a doubt. Significantly more people that have multiple people on the plan than just their single self. We've known that forever. Very good. I've got some marching orders. I'll get back to that. The last thing I'll leave you with, I know the medical is a big component, but on page 14, dental increase is very minimal, right at 2%. That's a matter of 10 or 12 cents for an employee. I would just, we went through it and I don't think anybody's having major issues. Vision's in a rate guarantee, so no change to rates or benefits for vision. No change to your life and disability rates. The one suggestion that we made is currently the county has a legacy, what's called a guaranteed universal life insurance benefit that employees can purchase. We don't have very many people that utilize it, and it's really, really, really expensive. And so what we thought about doing was transitioning that universal life product back to what we call voluntary term, which is still providing life coverage, life insurance coverage significantly cheaper. Okay, the impact would be maybe a handful of those employees have some sort of a cash balance in their guaranteed universal life contract, but Principal will work with them to let them know what their options are. Terminate the policy, they can continue it, they can cash it out, but I think it would be beneficial to do that, and so I'd recommend doing that. And then last but not least, you guys have had AFLAC products in place for a number of years: accident, hospital indemnity, cancer, critical illness. We suggested moving those over under your life and disability carrier, which is Sun Life. It's cheaper. I think it provides a better customer service, and then it's certainly easier from an administration standpoint of it's one less bill that people have to administer. So I think there would be not a lot of disruption once people kind of got rolling with that. So.
And our life insurance at the county, the $20,000 that we provide is with Sun Life as well, right? So that
Nothing's going to change.
Just pointing that out, that
This would
principle is different than
Right.
the
Principal
insurance,
is
the
an
life insurance
individual.
that
They're
county
individual
provides.
contracts. and we looked at the numbers, and I should have wrote it down.
There
but
wasn't many people. that had-
Very, very few. Some people have it. If you're going to have it for just the life insurance, it's incredibly overpriced. There has not been, I don't think, very many people that have invested in the cash value portion of that. So,
And for those folks, there's lots of, I mean, if you're
Principal
really bent
or
on
the
having a
directly.
universal whole life policy there, Google will pull up 8 million vendors that will happily sell you some.
And you can keep this even
And
if
you can
we
keep
part
it.
ways
Absolutely.
Absolutely. On the group chassis. It's individual, so you can keep it. So we wouldn't
Right, they
take it
could
away.
keep it, it just wouldn't be in the.
It just wouldn't be
piece,
payroll
yes.
deducted.
Right, they were just on their own.
I'm good with all those back page changes too. And then the last thing I had for this, and I'm not trying to muddy the waters on it, but I do think that as a board, we're taking on a lot of stuff these days, and so I'm not looking to throw more irons in the fire, but I do think that at some point we should get with our wellness program and at least make sure that we're all on the same page, that the things that wellness are addressing are things that are gonna reduce costs, and frankly, if they're not health-related and cost reductions, I'm not real apt on providing points or credits or whatever for it. I think that some of the things on the sheets that we looked at were things like obesity, not all diabetes, but some, mental health for sure. Some of those things that, in my mind, that should be the focus on those cost-driving mechanisms that make this process not fun every year. If we're going to be allocating $50 on a monthly basis for wellness credit, it's my opinion that wellness needs to be pretty narrowly tailored to things that reduce costs. And if they're not doing that, that's fine and commendable, but it doesn't seem like it serves the same purpose for what it's intended to do. And so I just want to get together with wellness and the board at some point to sort of go over what the plan is, what the plan historically was, and what the plan shall be going forward. Really want to take on a whole lot more right now, but that's something I think we need to do. So
Yeah, those links between the chronic conditions need to be
things
addressed.
that they can change and affect need to be the focus if people are going to get the credit, because now from my perspective we're offering incentivizing people into going into a health plan. We're incentivizing people with a wellness credit, and that's commendable and good, but we need to make sure that all of those things
Right.
are working towards a common goal of driving costs down.
you got it.
So,
Yeah, and that's, and I don't have the stats with me, but historically, the county, and I think this is partly because of the point system, but you guys have had way higher than normal percentages of people getting preventive visits, which is probably why the office visit is the way it is. What drives some of that down. So stuff, to your point, stuff like that.
I'm not being
prevents-
critical of the program.
No.
I think, in fact, that's a great thing.
Absolutely.
That's helping our costs. I just want to make sure that the program, the wellness
We're
program in
incenting for the
general,
right thing.
is
Is
very
connected.
finely
For
tuned
sure.
to things
For sure.
like that are
Right.
driving costs
I'm sure
down.
there's things in the point system that maybe aren't necessarily tied to positive health behaviors, but stuff like, routine exams and,
Absolutely.
that kind of stuff, I think is a big thing. May not pay off today, but hopefully 5 years from now it does, because I, control my diabetes before I get it. Okay.
Indeed.
All right, we'll get back to work, get you that spreadsheet, and then we'll follow up. Thank you.
Thank you.
Thank you.
And when do we have a deadline to?
I
know
don't think
we're
we've
early.
scheduled enrollment. We got plenty of time.
Okay.
I mean, the drop dead complete deadline's December 15th. I don't think you want to wait till that long.
No.
We won't.
But we'll work with Heather and team on when you want to have some meetings. And then we've got our communication team already working on some HSA communication. So the thought would be, let's start dripping on them on this is what it is. It's not a takeaway. It's an option and an enhancement for a lot of people. So once we get kind of contributions finalized and that kind of thing, then we'll start sending out some communication.
Perfect. As was with most things in life, any changes that are not accompanied by education, facts, and some presentations probably don't turn out so well.
Are perceived as negative. Yeah. Thank you, guys.
Thank you.
Have a good day.
Okay, item number 2 is our discussion of HR position. And if you look in your packet, we have a job description. And I would like the board to consider giving our board assistant the authority to go through this with myself and fine tune it to more of our needs, and then to drop the salary. So, thoughts on that?
So this, the conversation on the HR has been, do we do the same as what we did before, what we were looking for before, or do we modify it in some respects? Before we were going for that higher level, higher education, is that what the board wants to continue with an HR? Crystal had suggested morphing. Heather right now does the benefit piece of the HR. And so do we want to merge that with what this HR person does and let Heather be 100% into the engineer's office? Because that changes what this job description looks like, changes the function of it, the functionality of it. So the intention of the board with the HR position is, I guess, the conversation to have. Right now Heather does the benefit piece, and then that information is given to payroll enters it in. FMLA, those are the two pieces that Heather works on, onboarding and FMLA.
short-term.
And so the HR is intended to do the onboarding, do the FMLA, do the, so do they just take over the benefit piece of it as well, because that's a function of HR? And then that would put Heather 100% at the engineer's office as opposed to working for the board at all. And then that changes this job description. And if it's going to be more of that kind of technical hands-on, I also don't think you need, if you're not looking for all of the acronyms at the end of the name, if you're looking for more of that type of function that can grow into a greater coordinator position, that's a different conversation than what we had previously. So I'm not real sure what to post for, what the board's looking for, where they want to go with HR.
I would add that Heather also does short-term and long-term disability claims and deals with that, and we've had several in the last month.
Right.
So,
But that's
a
what
portion
previous
of
the
it.
HR was it got kind of morphed there, but previously the intention was for the HR person to be the administrator of FMLA, short-term, long-term disability, all of those items.
And I understand that. I just want to
Yeah.
make sure we were clear that that's also something that she's doing at this point.
Right.
Crystal, what are your general thoughts?
I feel it's so important that we have HR. The majority of my time has been taken up in HR issues that really should not be, because I'm only one person and I sit on a board and I cannot be making those kind of decisions or dealing with those kind of matters. So it's imperative that we have, for the employee's sake, that one person that they can depend on and go to in times of crisis in their life, whether it be with the employee or personal, dealing with insurance, whatever. Having a knowledgeable person in that, and I believe Heather's done a really great job in that. But consolidating it into that one HR, I think, would be really important moving forward. And tailoring this job description down, we want a more hands-on person to really just get in the nuts and bolts of everyday county life instead of focusing on, leadership skills or whatever, which can be addressed in other ways, but really I want them to focus on the employees day to day and inputting the insurance, dealing with those issues, trying to think some of the other things that come up during the day that either Megan or myself handle, and it would be so nice to have that other person. I've also talked to Mike Galloway about providing the legal aspect of HR, of being a support to the county, which would be really helpful in this situation. We don't have to have someone with such a background in HR. That person can rely on, and I think it was $2,500 a month.
Yeah,
For that
there's a
support.
different pricing sheet depending on how much, but it's essentially, instead of paying as we go with Allers and Cooney, it's a, you kind of
It's
set
flat
up.
fee to run
Yeah, it's like
HR
a, like a
legal
retainer,
matters.
yeah.
Well, the nice thing about that is you're not paying for the expertise in the position.
Correct, and that's the thought, is that you make it maybe not as high-end and not looking for that master's degree in human resource, as opposed to looking for maybe someone that's more very good at coordinating and reaching out to others and making those things happen and being able to, because we do have an interesting situation with HR, because we have a board of supervisors and you've got 3, and so it's a little bit different situation. Or, I mean, we can, the other is we could still modify this, but then Heather would continue to do the benefit piece of it. But I don't know, what do you think, Heather? Do you think because, you used to do other stuff for the board, but you didn't used to do FMLA and the disability. So if that person's doing that stuff and you're just doing the benefit claims, do you still think that's a 50% board of supervisors?
I have done some time tracking, and I think it's probably fair to say it's probably still pretty close to 50%.
Okay.
Heather, what are your thoughts? You've sort of helped out in a pinch. What are your general thoughts?
Dawn has been very beneficial to helping out with a lot of the HR stuff. I feel that we've tackled quite a bit of it together. As far as going forward, I think just a decision in general needs to be made. This whole limbo thing needs to come to an end. So just a decision.
Yeah, kudos to you too, Don. I didn't mean to exclude you.
Yeah, sorry, but you've been outstanding the last.
No worries.
Well, with that, then I'm pretty okay with having a more hands-on, limited, not as many acronyms at the end of their curriculum vitae sort of HR position. I will say that as jobs have been posted, I noticed that all of the Indeed resumes hit my inbox on a frequent pace. And I do
You like
think,
that?
No.
You want that to end, don't you?
Yes, I do. And so I do think that I see some benefit there. I think that we need to find the right candidate who is hands-on. I appreciate in a large company someone who's doing theoretical, high-level leadership training things, but that's not our need at the county in present day 2019. What we need is someone who can handle the benefits, handle the individual county employee matters, sort through and filter resumes when we have openings, and bring the top 2 or 3 candidates in for interviews. So I would prefer it to be somewhat limited. Maybe we can find that in an employee that's interested in even 30 hours a week or 40. I mean, I don't know what it exactly should look like.
Right.
But and if it's a full-time employee, then so be it. But
I think if they're doing the benefits piece as well as all of
It probably will be.
it's a full-time position. So, that's the question for, if you're wanting Heather to continue to do the benefits piece of it, or is David, would you need a full-time? Heather, would you be able to?
Any
Because
help in our
because
office is
if
a
you,
benefit.
if you change that, then that's an additional 20,000 plus to David's budget for staff. So, that's the other piece of it, if David's. So it sounds like that's what you'd like me to post for. Doug, do you have any?
Okay, yeah, do we were you proposing that we use Allers or we use Dawn or how, what?
Well, I think
I
ours is
understand
kind of
the
that
hands-on.
high, you know, the sticky situation type.
But still, $2,500 a
Right,
month.
right. And I don't have that pricing with me. I can,
Yeah, I know, I understand, but
this piece, I don't know that you need to determine that. This piece of it is independent of that piece because either using Dawn or using Allers, they're gonna
Okay.
have access to legal.
Yeah, it might be less expensive not to enter into a contract with Allers for that aspect and use them on a pay-to-play basis
Sure.
where needed. I mean,
Yeah.
I
It
agree.
just kind of depends on the ebb and flow of what we have going on. I mean, we use Mike now when we get into.
And the person we hire too, they may feel very confident in
Sure, I mean, it's just gonna.
using our resources or.
That's kind of an unknown at this point. The scope of what this position needs to be is because I have no idea what the board wants to post for in refilling this, because, does that make sense? So, I mean, it sounds to me everyone wants it to combine that benefits piece into it.
And Heather and Don, are you both fine with that or not fine with that? What are your thoughts? I mean, you two have been doing that aspect for the last.
I think it's
few months.
helpful to have somebody here that can answer those questions and deal with, versus people who stop in. My office door is always open and everybody knows that, and so people stop in, which is fine, that's what I want. And I think that's what's best for the county, is that there be somebody on site that can talk through those issues with employees when they have those questions.
But there's also conflicts of interest that come up.
Oh, I
Which I
understand.
have seen, so it'd be
Yeah.
nice as a resource to have the
Yeah.
Allers and Cooney. And we're looking at a hiring date of possibly December or January.
I would say
1st.
January 1. That's kind of what we had talked about.
Budget-wise.
Yeah, budget-wise, being able to, David, does that work with your budget to be able to do that? Or do you want to wait till the new fiscal year to switch that?
It's already accounted for.
Okay, okay. So that's that piece of it. We can do, I would say maybe a January 1 hire. Get that one posted, get administrative clerk hired, and then get that piece hired in January. Move forward with that. And you know, with that is, I do need to get with all of you after the meeting to get a schedule to meet with applicants, by the way. So don't run off, I guess is what I'm saying. So then the other thought on that, that I'll pull maybe some similar job descriptions and wage ranges, but I think you're looking more like an HR generalist type wage, which is not as high end as what we were looking at. So I think that would go down on the pay matrix as well, so, which will change those budget numbers. But I think I have direction and I'll put it together.
All right, thank you. Okay. Our next item up on the agenda is discussion of secondary road shop site project. David?
So we've had a couple meetings on this, but kind of leading in from those last 2 or 3 meetings, we wanted to present some more refined costs, especially showing different interest rates for a loan option on the shop site. I know about a couple weeks ago, when we were setting up schedules for this meeting, I think the interest rates dropped again, maybe half a point. I know Nathan's here with DA Davidson if there's any more specific questions related to it, but this shows kind of the 2 different scenarios, a 20-year and 10-year term, with the full project cost set at $7 million, and part of that, at this point in time, the secondary road department still has that $1.5 million or so dedicated to help offset some of those initial payments. But I guess we feel it'd be wise to capitalize on something of this nature while the interest rates appear to be at an all-time low. So if there's any questions on that, I think this is discussion only at this time, so.
Yeah. So, and you're thinking the general fund loan, correct? The general fund loan option is what you're anticipating.
Yeah.
So, and I included that summary sheet from when we had Mark Corey here from Allers, and kind of that summary of how that loan agreement payable from the general fund, what that breakdown looks like, and the process the board would have to go through to do that. So the loan payments per these sheets from DA Davidson, you're looking at between $500,000 and $800,000 for a loan payment on $7 million. So you're going to drop that down. If David's putting forth $1 million towards it, but that would be off the general fund. So that would be, the board needs to, I mean, clearly plan for that into the future if you're going to be spending $500,000 to $800,000 off of the general fund. What is going to be the offset for that? The amount that we send from the general fund to secondary roads is $300,000. So just even cutting that would, one, cut David's operating, but then also wouldn't even cover the loan payment. So it's got to be a conscious decision that, and I included also a list of all of the general fund expenses so you could see where those expenses are at, where you're looking to cut from. And of course, I mean, we can count on growth. We do have new legislation where there's an additional hearing for any revenue growth over that 2%. So all of those are going to factor into that going forward, and then whether you do a 10-year or a 20-year and loan to tie up those general funds.
And the $500,000 to $800,000 was based on 20 years?
The $500,000 is the 10-year, I think, and then the $800,000 is the $800,000 is the 10-year, and the 500 is the. Did I get that right, Nate?
Yes.
Eventually.
Makes sense.
The general fund levy is already at its maximum, so you could not raise the levy rate on that to raise additional funds. So.
And I think that's what that 1.5 million would help with those initial payments to buy us some time to plan for as it switches over to the general loan, or the general fund.
What was the interest rates you were using at 20 years and 10 years?
The true interest cost on the 10-year was about 2.5%, and on the 20-year was about 3.5%. That should be pretty conservative right now. As David mentioned, rates have fallen quite a bit even since I ran this analysis. So, but at the same time, by the time you get through everything, rates can go back up.
Right.
So what we're saying is, being at the maximum of the general fund levy,
Mm-hmm.
we'd have to reduce something.
Right, you would have to make cuts elsewhere. We don't know, and certainly tying up for 10, 20 years, I don't know what values are going to do. Yes, do I
Yeah.
assume they'll continue to go up? Yes, I do. But you'll be making that obligation for future budgets that this money is dedicated, so you'll have to make those adjustments in other departments within the general fund to make that feasible within budget.
And the only reason that maybe valuations wouldn't go up would be the legislature saying.
Right, I mean, you know, they passed legislation to put that 2%, but it has a soft cap. In the future, if they put a hard cap on it, then
Yeah.
you'll definitely.
And we do now have a speaker that's more rural than urban, I see by the morning paper.
Yeah, Mr. Grassley, the new speaker.
Yeah.
Here are my thoughts. I am really desirous of getting this done because the rates are low. I view it as a need versus a want. But my hang up is the reality of at 10 years, which I would prefer financing shorter term than longer term. I prefer 2.25% versus 3 point whatever, 5 or 3.4. You save money on interest on it. But as I see it, that's $800,000 that has to come from somewhere. So unless I know sort of from where that 800, which department's gonna get hammered $800,000. I was online, I don't know, a week or two ago, and people are confused and perplexed about how we can find what I anticipate 9 cents on the general supplemental levy rate at $125,000 to $200,000. It was, where will the magic bean be found to find that sort of money? And we can find that sort of money. As a percentage of the budget, 2% is pretty findable in my mind. In fact, we just had our health insurance people from True North that proposed, some savings, which we're not going to do, but some savings in the $40,000, $50,000 range. Potentially, not that we're going to, because I anticipate we'll incentivize to some, but there might be 10 or 15 that would be what I would call true savings. But finding $800,000, I guess at that level, I sort of need to know from where are people proposing this is coming from, because we can't cut the auditor's office $800,000 and still have elections. We can't cut the county attorney's budget $800,000 and have staff to run trials. We can't cut David's budget $800,000 and put rock on the road. And so I don't dislike this, but I'm telling you, $800,000 is a mountain of money to find from a $13 or $14 million budget, and until I know some teeth into it from where that comes, I'm not real inclined to say let's go down this path, because that's not fiscally wise to say let's hope valuations continue to increase. Hope's not a strategy. It might play out that way. Our county thankfully is growing, or we would be in a real predicament. So what I've said at prior meetings and what I continue to feel would be appropriate, and I know that you don't like this, if it needs to be done in one fell swoop, put it out to bond. If it doesn't need to be done in one fell swoop, which I know is not ideal, and I also can do math, and I know that will cost more. My suggestion would be to phase this, because could we do $3.5 million of a large start of the project with some contribution on your part and am it out to 20 years and get it started? Yes. And then we might need to find, quote unquote, $200,000. Is that ideal? Nope. But sadly, in our position here, there's rarely a choice that's just super easy and pain-free. And so, absent someone telling me where we can find $600,000 or $500,000 to $800,000, and I'll entertain it. I'm open-minded. But absent that, then I would say I think the default is either one, go out to a referendum for the whole shooting match and maybe some roads, and I'm happy to do that in the spring of next year or whenever, or phase it into $3 million, $3.5 million with some contribution, ham it out to 20 years. That's still probably not super prudent, but we'll be at 3.25% or 3.15 or 3.5%, and that gets the project going. So those are my thoughts.
I would just say I think our starting point probably to be more in the functional range would be 5 million, and then at 5 million we'll be knocking things off like the salt sand storage building and one of the cold storage buildings, things like that. But I think a starting point now, as we're 2 and 3 years into the process, is probably around 5 million to get something functional out there that closely matches what we have now. But building's obviously a little larger to house the type of equipment we need to house. So,
and then I guess a tough decision would have to get made on, are you comfortable using 1.5 towards the 5 if we ran, let's say you were, and just by my looking at this at 20 years, if it's 500, and if we're at 5 million, you're kicking in 1.5, that's 3.5, that's exactly half of 7, which means we'd have to find about $250,000. It's not easy, but it's a discussion that I'd entertain. But we have to start putting pen to paper on where it is, because a loan from the general fund that has repercussions for 10 or 20 years, we really need to know from where that comes. And, you know, for all practical purposes, we can probably add another 150 of finding money is what I anticipate is going to be coming down the pipeline. So,
And we'd like to sit here and tell you we could contribute more in future years, but we just can't make that guarantee with, you know, how weather dependent we can be. Some years we have a bad flood year, bad rain year.
I understand, you're behind the 8 ball on it, I get it. So that would be my guess, and my other suggestion is, I know you've said 5, and I guess what I would do if I were you would be working with the architect or working with the designer and finding out sort of like my experiences on the user group, find ways in which we can make it 4 or 4.5 or whatever we can do, whatever is not imperative day one. Those are not fun decisions, but that's how things get done.
I just don't see us dropping that low at this point in time. I know there's other counties building shops that are in the 10 million plus range, so I don't see how a county our size would be able to drop it much further from the 5 to 7 million range. When other counties smaller than us are building them for $10, $15 million.
What's unique to me is secondary roads gets the benefit, but the general fund, unless you take something out of the transfer, is paying for it. Yeah, and that's can affect a lot of things in the general fund. It's just unique. Unless you take the 300,000 or part of it, or so that's a tough. That makes it even more difficult for me.
It's a sticky wicket. So I guess that's the homework is, and I can't tell you, I'm not supportive of saying $7 million and 800,000. There is no way. I mean, you can't show me the numbers beyond Doug's argument of how this conceptualizes that are going to work out to say we can find 800. I mean, I don't see it. I don't know which employees are getting the pink slip and which department just goes away, or if they all become non-functional. That isn't a scenario that I think's beneficial. And so maybe if it really is one fell swoop, get it done, let the folks have a vote on it. It would be much more prudent to finance the whole thing. Now, I don't know how they're gonna vote, and that clearly might not turn out well. I think that's a reality. But it at least gives people an opportunity to look at what's there and what's needed and what other counties have done and what we're proposing and why we're proposing it. Coupled with some education, you might be surprised when they also realize that it's maybe not a great deal of money between 53,000 people aimed out over 20 years over low interest rates. I don't know. And if that's not the path that we go down, then I really think, you know, get the numbers at 4 or 5 or maybe 5, contribute some and highlight where we're finding 250, and we'll think about it. I mean, that's all I can tell you. I wish I had better answers. I don't. And the sad thing is, it's $6-7 million this year. It'll be $8 million next year. It'll be $10 million in a few years from now. And I've only heard one person, and I'm sure there's more, but I've only heard one person say our county shop site is perfect and there's no reason to do anything. I've heard one person say that.
Was that me?
It wasn't you, Doug. It wasn't you. But absent that one gentleman, I've not heard anyone who's actually seen it. I get it, it's a need. I'm on board with you. I just wanna get you there. And that's sort of how I sort of see it happening, but I don't know.
I mean, if you get that payment down to that 300,000, Are you interested in ceasing that transfer to the secondary roads to make that payment?
Possibility, of course.
A portion
That's
of
what
it,
I was
maybe.
looking
Yeah,
at that
sure.
too.
But,
That's an option.
yeah, maybe you take 150 from it and then find the other 150, which you gotta have some skin in the game too. I get it. Otherwise, we're cutting services to other things.
To
But
other-
but if we cut 150 from your budget, you're gonna hear people say, well, that's $150,000 less rock the first time that the
Right.
spring thaw comes out. There it comes.
Yeah.
So. I don't know.
And the transfer is based on valuation, so depending on what valuations did on that rural piece will affect how much could be transferred from the rural fund into David's.
Yeah, and we have some flexibility. I mean, when we're affecting our budget, if we, what it realistically could affect is we don't do a lot of construction projects with local dollars, i.e., your pipes, bridges, things like that. But that's not to say we aren't flexible with our farm to market and federal dollars we receive and how we bundle things. So we do have some flexibility, like you mentioned. It's just maybe it's $200,000 or $300,000 worth of flexibility, but not anything higher than that.
I mean, I think that's your path. If I were you, that's what I would do. Cause I know you said, hey, we're pretty tight at 5. I'd beat out the cost of 4.5 or 4.7, put in chunk. I'd look at amming it out 20 years. I'd keep your fingers crossed, interest rates keep going down. I'd say you're willing to drop $150,000 of the max transfer that you should anticipate, because I think will happen. And then the board would have to find another 100, 150, and that's in the realm of possible. Still cut, I mean, still there's pain,
Right.
there's,
How about our lost tax income from that?
100% property tax relief.
100%, yeah.
unfortunately, that wasn't exactly worded the way I would preferred it to have been worded, because that would also be a great pot that should go towards a capital project that benefits rural people, which I can't think of a better one than this.
I know.
I could argue that the courthouse justice system would be another good one, but this is even better for rural people. And so that's the way that really should have went down, but that's not what got voted on.
If it does go to a vote, are we able to present kind of more options as, do nothing, levy increase, or bond, different options to the voters versus one option?
You can do it however you would want.
You mean if you took it to a bond?
If you went to a vote, you could.
Yeah, you'd have
You
to
could
have
give 'em
educational.
more than one
yeah,
option, though, I
yeah.
mean.
The county can present educational material only. You can't advocate voting one way or the other. But you can say it's gonna cost this much if we do this now, it's gonna cost this much if that's just data. Yeah.
I think that might be, if we go that route, something we provide with the language. So they don't, if you say no to this, well, what's the effect of it? We don't really touch on what the benefits are. We just look at costs sometimes, and what benefits are we losing, or what costs are we gonna have in the future because we don't do this?
Absolutely.
And the county would certainly have 7 acres sitting there with a lot of work needed to be done.
40. Isn't that thing 40?
Yeah.
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 Well, I
40 town
think
acres.
it's 20
Oh, no,
and 10
7
buildable.
there.
Oh, you mean the
40
old
now.
shop site?
Yeah.
Yeah.
Oh.
Yeah, 7 or so, yeah.
Yeah.
Potentially 1 year, that could square, I mean, if we're at $150,000 or $200,000 of needing to find money, we could sell that for $400 or $500. I mean, you might pick up two seasons of offset by getting that sold.
We had an appraisal, I think with quote unquote, the 2 sites was close to 500, but that's been a bit.
So maybe it's 600, I don't know. I mean, you might get 3 years out of it. So, but I can't stress to you enough.
Yep.
If you want to make it happen, it's not fun sitting on the group I sit on. It isn't fun. I literally feel like the Grinch who stole Christmas. When he goes into the homes and he pulls out the tinsel and the presents and all the nice stuff. That's literally what I'm doing. So if I were you, I would work on what is an absolute first year, day one, when it's done, necessity, and then what, if it can be done at a later date, like salt or anything that can be done later, you work on doing that part later. And we're not kicking it down the road, to some extent you are, but it gets you to the first chunk. And so I'd work really hard at getting it at 4 or 5, kicking in some, selling the current place theoretically, and then having us as a board find 100.5, 175, something like that, which is possible, not easy, but possible. So that's the way I do it. But or take it out to a vote and let the people say what they want to say. I don't know.
Crystal, what are your thoughts? Are you interested in the general obligation loan, or are you interested in doing a bond?
I think I'm interested in doing a bond. It's just been waiting too long. I don't have confidence that this would pass. That's just my thoughts on it.
That the bond would pass or what?
Yeah, I don't have confidence that it would. So, I would rather just bite it now and let's start this and get it going. But those are my thoughts.
Are they mutually exclusive? I mean, is there any, other than, once again, going to the voters with a bond, I mean, at some point, play the same card over and over again, or I might get a little tired of it.
Yes, you could do a bond, and then if that doesn't work, you could do a general obligation loan. I mean, there's not a time limit on the general obligation loan.
Yeah.
The only, your limitation is simply your 10% of the general fund expenses.
You could also do some mix of the two. You could do a general fund loan for half of it and get 3.5 of approval from voters and do a mix of funding too. There's infinity solutions there, just splitting into 2 different financing methods.
If it goes, the loan option is just a matter of finding what yearly rate we're comfortable with, and then maybe doing a mix with the bond and the loan to ease the burden on the general fund. Is that kind of a,
Yeah,
That's
So
just
the bond
another-
can only be by the vote.
but
Yeah.
I'm gonna be honest too, I don't sense that a bond's gonna pass. So I think you have to, I mean, it's probably a little more than just an annoyance to the voters to see the bond, but that's not a huge concern to me. I mean, if you don't like it, vote no.
Sure.
If you like it, vote yes. I mean, I'm not too worried about that, but I think it's gonna pass? I doubt it. I doubt if you put a $7 million shop site out there to the public that it passes. Is it still worthwhile to get people thinking about it? I mean, maybe, and maybe it does pass, I don't know. It depends who votes. I mean, it's what all these things come down to. That would be the easiest way to do it all at once and probably the cheapest way. So I think it's probably worthy to explore. But at the end of the day, I think Crystal's probably right. If you want to get this project moving, beat the cost out of it, get it down to 4 or 5, contribute some, have us go find some with some cuts over probably 20 years. Is there any, I hate doing this and I'm not proposing this, but can we am something out 25 years?
No, not general obligation. Iowa code restricts you to 20 years.
Okay.
and I mean, if we're saying we can get down to 5, I mean, that's still our 1.5 dedicated from secondary roads, so it's still that $3.5 million range.
I'm just looking at scenario B though, David. If we're at 3.5, that's half of 7. So that means estimated annual payment off the general fund is going to be $250,000. So I guess my thought would be, if we did that and we were obligated at $250,000, I would say at a minimum, I would probably say 125 or half of that probably then doesn't get transferred to your budget. And so that we're then left finding $150 or $125,000, which is, the lower that number goes that we have to find, the easier it is. But when you have things like cost of living, when you have things like insurance, that's why we worked really diligently on getting not a 7% just increase for another whatever $100,000. We worked on that so that we can present a plan that maybe comes in 40 under, because I'm trying to think ahead about where we can find some of the things to get done, the things that in my mind this county needs doing. And I think this is one of them, but at $125,000 it becomes a lot easier. I'm not naive. I know that the assessments went up in this county. I know that homes in Norwalk that historically were assessed at $120,000 5 years ago, with the recent comps at 160, the assessor had to put them within 6% per the statute. So there's going to be a bigger pool, which takes some of the pain out of what we need to do. But we're gonna have to find a way to get that number as little as you can if you want it to be successful.
And that's gonna just simply take taking out buildings at this point. I mean, we've had 3 years to look at things like soap dispensers and outlets. We've done our energy saving reviews, all that, the whole 9 yards. Been sitting there ready to go. So if we're gonna talk phasing, we just need to talk about removing cold storage buildings, your salt sand storage. But then again, that puts you at the 5 million. Like you said, we could come back here next year. Now we're at 5.5. Now interest rates might be 6-7%, and now we're kind of dead in the water, so to speak.
If it's 5, it's 5. I'm just telling you, I'd find a way to get it as low as possible, because the least impact on this path to go with a loan, the least impact is going to have the greatest opportunity to get through.
In my particular case, I'd like to bring something to me to vote on, but this is probably our
This is
third,
discussion.
fourth, fifth time we've kind of just said the same thing. But yeah, we need to look at selling the
Yep.
7 acres or whatever it is. And
Because selling the 7 acres for
But I just
500 or
like-
600, I mean, that gets
Yes.
a ways
Yes.
on finding, by halving that obligation at 250 to you.
Because at the 20-year, we're looking at our department picking up at least the first 3 years. And maybe the sale of land.
But is that's with using your 1.5, right?
Yeah, that would.
But that's
and
not-
buy time to figure out how we're gonna find the cost in later years, but it would get it going at the.
Yeah, but then it's not $497,000 because the full, well, it'd be 5.
If we just made those
it'd be
initial
350.
payments on the 20-year, and then
Okay.
it'd buy us maybe 4 or 5 years to
Okay.
try to save money.
I agree, though. I agree with Doug. In that we can talk and talk and talk, and at some point,
We have
it's
to do
time
it.
for decision time.
We gotta do it, yeah.
So,
Tracy, when would be the next county? I mean, you've got a November for a county special. When would be the next time that they could do another?
I think it's March.
Is it March?
It is
That's right.
March.
Okay. So March would be the
Except
next
in
that
the
you could-
presidential year,
and do it a few more
so
times, I
that would
think.
not be, okay, never mind, sorry.
Okay.
March, May, and August.
I think it's cut back to maybe 2.
Is it two?
I think it's only 2.
So the recommendation is
Okay.
I think it changed this year.
bring a proposal, bring, if you and Crystal want to work on it, that'd be great, or I'll talk to you about it too, that's fine. Bring some ideas on where another 125 or 150 or 200, because the loan obligation has to be repaid back, so let's start talking about actually from where that can come from. And then we can vote on it.
Good by me.
Okay, great, thank you. Moving on, consider, item number 4, consider acceptance and approval of bids for project number LFM-R63, parentheses S in parentheses dash 7X dash 91. Landslide stabilization with possible action.
So this is for the second landslide stabilization on County Highway R63, just about under a mile or so north of Highway 92. We had two bidders on this project. The highest apparent bidder was Vanderpool Construction. And the actual, this will be a little different than usual, but the actual bid price submitted for this from Vanderpool was $376,000 and $376,375, excuse me. There were some calculations errors that were submitted, so another number if you correct some of those errors. Adjusted down to $374,737.80. And then the apparent low bidder would be Herbert Construction at $352,477.70. So we recommend award of contract to the apparent low bidder, which is Herbert Construction Company. And if any questions as to why I presented two numbers, we just had one calculation error or so on the bid sheet that we corrected, but regardless, that put them higher than the apparent low bidder, so.
I would take a motion to accept and approve the bid for this project.
So moved.
Second.
Roll call?
Schultz.
Aye.
DeCook.
Aye.
McIntyre.
Aye. Okay. Item number 5, consider resolution of support for the City of Indianola wastewater treatment plant with possible action. Don, do you want to cover that, or?
This one, Doug?
Yeah. Do I have a,
You got it.
yeah. Do I need to read this?
Probably.
Okay.
Do you want to explain it first? Or you just-
Well, yeah, I probably should read it first because it's probably been reduced from what maybe the city of Indianola would like to see us do, but I think I've been in town long enough that in '76, they built this sewer plant. So let's say that's 44 years. And I think when I came to town, Indianola had about 8,500 population. Today, I'd estimate us at 15.5. So you've got a plant that's probably sort of at its max. And then I'm assuming there's a lot of technology in the last 40 years that would make the plant more efficient. But anyway, it's something that the city of Indianola needs to do. So I'd read this resolution. Whereas the City of Indianola proposed wastewater treatment facility is designed to replace the existing wastewater treatment plant, which is inadequate in size and technology to meet all governmental and environmental regulations. Whereas an adequate wastewater treatment facility is essential for continued growth and health of the City of Indianola. Whereas continued growth and health of the City of Indianola is important to the welfare of Warren County as a whole. Now therefore be resolved that the Warren County Board of Supervisors hereby express support for the construction of a new City of Indianola wastewater treatment plant. It doesn't address a lot of things that I'm sure that could be addressed, but having said whatever I've said, I would move the resolution.
Do we have a second?
Second.
Okay. Discussion? Now, we do not have authority over this
Correct.
particular
Correct. It's just a
situation.
resolution supporting what the city's.
And it is the Board of Adjustments jurisdiction.
Correct.
But we are supporting the City of Indianola in their going forth to build this. I have listened to the meeting and some of the others, and learning about the City of Indianola taking Warren County to court. I've always been in support of this. This is a needed, necessary thing for the city of Indianola. I think it's imperative that we look at, sometimes the public can outcry against something and not truly understand the full importance of what is being given. So with that, I'll ask for a roll call. Tracy?
Schultz.
Aye.
DeCook.
Aye.
McIntyre.
Aye. Okay, seeing nothing else to be considered, I will call this meeting adjourned. You want me to see it?
Yes, yeah, hey, don't be running out.
Shirley did.
I know. Sure.